Hi, my name is Kara Smith, and I am the Associate Clinical Director here at the Resource Connect. I'm here to tell you about some guidelines that we've developed to help you get the most out of your group experience. First of all, you are expected to come completely sober, not under the influence of anything whatsoever. You are expected to abstain from the use of drugs and alcohol while you're here. It is important that you attend all of your scheduled sessions on time and with enough time to provide a urinalysis or breathalyzer or take any prescribed medications that you need to take ahead of time. Being a part of group means that you agree to preserve the anonymity and confidentiality of all members in the group. That means that you can't disclose anything that's discussed in the group, the identity of any group member, or any group content to anyone outside the group. So what goes on in group stays in group, and there are no exceptions to this rule. It's important to know that becoming involved romantically, sexually, or financially with any group member isn't really allowed because this tends to be toxic to the group process and it hinders people's recovery efforts. Please be aware that if this does occur, you will be asked to leave the program. You will also be asked to leave the program if you use with anybody in the group or bring any alcohol or drugs on site. You are expected in the group, though, to raise any issues that threaten your own sobriety or anyone else's recovery in the group. It's expected that group members will be honest, present, respectful, and open to feedback. These are some guidelines that have been developed to help make your group experience as effective as it can be.
Group therapy has been shown to be extremely effective with people who have substance abuse disorders. Why is that? Well, it's because the people with substance abuse disorders tend to come in with a lot of shame and guilt. And what is shame and what is guilt? Well, you'll learn that in the program. What's important is that you share as much as you can. You be courageous. You be kind to other people. Therapists in the room will never let abuse occur. They will never let somebody be unkind or mean to another person. That's not okay. But they will ask that you be mutually supportive with one another, and in that way you'll get your needs met, and so will other people in the group. So you're also going to meet with your case manager for individual sessions. Those sessions are going to start more frequently, and then they're going to become a little less frequent. During those sessions, you're going to be talking about goals that you and your case manager have decided to do that are listed on your treatment plan. The expectation will be that you will be following the treatment plan to achieve the goals that you and your case manager decided at the outset of your treatment. Every few months, if you stay here that long, you will be working with your case manager to develop new goals. Our goal here is to help you get what you want, not for us to try and control you and get you to do things that you don't want to do. So if there's something you don't want to do, please let your case manager know as soon as you know that. Addiction is deadly and fatal in some instances, so we take it very seriously. When you write down information about your emergency contact, we hold on to that. And if you don't show up for an appointment, if you don't show up for a group, if you don't let us know when something's coming up, we're going to call that emergency contact information to make sure that you're okay. We don't want any tragedies, and we really pay attention to you being here.